Hello, everyone. Welcome to today's webinar, Current Thoughts, Future Actions. What is it like being an independent practice right now? Presented by Dr. Dee Warmath and Dr. Grapri Daliwal. My name is Paige McReynolds, and I'm Cario's Marketing Campaign Manager, focused on helping Cario find and serve independent practices and medical billing companies like yours. Today, Dr. Dee and Dr. Grapri will host a panel discussion, diving deep into 8 key insights from Cario's 2021 State of the Independent Practice Survey and what the data means for the future of independent practices, including 4 key categories: COVID impact, industry outlook, care delivery, technology, and patient engagement. The biggest changes compared to a similar survey conducted in 2019, and how independent practices can compete and thrive in today's market. Before we begin, I'd like to point out a few things on your webinar screen. There's a comment box where you can type in your questions at any time. At the end of the presentation, our presenters will respond to as many questions as we have time for, and later, we'll email you the responses to your questions with a link to the recorded webinar and all related resources. If you have any trouble with sound or with the slides not moving forward, you can try pressing the refresh button, which is the icon with the 2 arrows going in a circle. And if you still have trouble, feel free to type into the comment box and we'll do our best to help resolve the issue. If you're on Twitter, we encourage you to connect with us at Cario. We're also on Facebook and LinkedIn, where we share industry news and educational resources to help you succeed. We are proud to inform you that this webinar has been approved by both Paycom and AAPC for 1 CEU credit. If you would like to receive a Paycom certificate, please fill out the survey at the end of the webinar. If you would like to receive an AAPC certificate, please email webinars@cario.com. Certificates will be emailed within a few days after the webinar. And now, I'd like to introduce our presenters. Dr. Dee Warmath is currently an assistant professor of consumer economics in the College of Family and Consumer Sciences at the University of Georgia, where she teaches courses in consumer well-being, social entrepreneurship, and consumer analytics. She earned her Ph.D. in consumer science from the University of Wisconsin-Madison and a master's in sociology from Vanderbilt University. After a successful 28-year career in industry, Dr. Warmath made the switch to the academic career path. Her research examines the individual's capacity to make decisions and the impact of involving others in those decisions on well-being in the areas of finances and health. Her role as academic program coordinator for the Masters of Consumer Analytics program is what led to her involvement in the Cario State of the Independent Practice report as the supervisor of 2 graduate students, Camden Cusimano and Evan Pierre. Dr. Grapri Daliwal is a clinician educator and professor of medicine at the University of California, San Francisco. He sees patients and teaches medical students and residents in the emergency department, inpatient wards, and outpatient clinic at the San Francisco VA Medical Center, where he directs the internal medicine clerkship. He studies, writes, and speaks about how doctors think, how they make diagnoses, how they develop diagnostic expertise, and what motivates them to improve their practice in the systems in which they work. Dr. Dhaliwal is a member of the UCSF Academy of Medical Educators and the UCSF Department of Medicine Council of Master's Clinicians. He has published 130 articles and has been a visiting professor at multiple universities across the U.S. and in China and Japan. He has received multiple teaching awards, including the 2019 UCSF Osler Distinguished Teacher Award and the 2015 National Alpha Omega Alpha Robert J. Glasser Distinguished Teacher Award. In 2012, he was profiled in the New York Times in an article entitled, "Could a Computer Outthink This Doctor?" Dr. Dhaliwal writes for the Wall Street Journal's The Experts Healthcare Report. He has been a podcast guest on The Curbsiders, I Am Reasoning, The Clinical Problem Solvers, and Explore the Space. He writes and speaks on physician leadership, physician engagement, the future of medicine, and the need for physicians to engage in high-value care. Wow, I am so honored and excited for the opportunity to bring these experts together and be a small part of this conversation. Before we begin, I would like to acknowledge that since this panel discussion is intended to come across as a group of colleagues catching up on really fascinating topics, we have collectively agreed to use first names only when addressing each other for the remainder of this presentation. And now let's give a little intro to the State of the Independent Practice Survey. Cario recently surveyed approximately 1,300 healthcare providers of independent practices across multiple specialties on what has changed in their practices since 2019, if anything. We wanted to know their current initiatives, challenges, industry outlook, and how COVID-19 impacted them. The State of the Independent Practice Survey is our second biannual survey. For this webinar, we brought together Dee and Gurpreet to discuss the 8 key insights that came from the survey data. We partnered with a research team from the University of Georgia's Consumer Analytics program to dissect the data and report on the biggest changes since 2019 and assist with the writing of the survey report. The team consisted of Camden Cusimano and Evan Pierre, serving as research assistants under the supervision of Assistant Professor Dee Warmath. And with that, let's jump into the 8 key insights. So key insight number 1, the Cario data shows independent practices in 2021 are optimistic about the future of their independent practice. Dee, what can you tell us about the data?
So Paige, we actually, when we started this project in the survey in January of this year, we were very curious about what we were going to hear about questions related to the outlook that independent practices had on their practice. And we knew it was very possible, given the circumstances, that the outlook would be pretty negative, but that was not at all the case. Overall, the survey data showed us that independent healthcare practice has emerged from the pandemic stronger and more resilient than ever before and committed to their patient relationships. So some of the statistics we pulled out here, 75% of providers are more optimistic about the future of their practice compared to 59% that we saw in the 2019 survey. And 51% of practices saw patient volumes return, with 22% of them returning to pre-COVID levels and 29% exceeding those levels. And related to these facts, we saw that 86% said they have no expectation to be acquired by a hospital, as opposed to 57% in 2019. So taken together, I think these all point to the fact that the independent practices are definitely have a positive outlook as they emerge from the pandemic and as they go forward with their practices. And Gurpreet, I'd love to hear some of your thoughts on the findings.
Yeah, I thought, thank you, Dee. I really appreciate that summary. And I thought this was one of the most optimistic and uplifting findings of the study because, you know, there has been a trend towards consolidation and employment and decreased ownership among physicians that's been going on for quite some time. So this is a bit of a contrarian story, but I think there's good reason to think that this might continue. One of the things that has struck me during the pandemic is thinking about the next generation of providers and independent practitioners. And one thing that's been remarkable is the number of people who are going to be going into medicine. You know, normally med school applications, they increase maybe 1 or 2% per year. And last year, the AAMC reported that there was an 18% increase in medical school applications. And there's lots of theories behind it, but one of it is what is sometimes cited as the Fauci effect, that a physician was sort of front and center in front of our country for the past year. And it speaks to the power, perhaps, of role modeling and gets at another question, which is, you know, how many of those practitioners may go on to pursue independent practice? And I have found it very hard to find the exact data on what percentages are interested, but there are studies that show why people become interested in pursuing independent practice, and it's strongly influenced by how they're imprinted. So if they're in a high-functioning clinic during their training, where they see quality care that they're proud to be associated with, the doctor has career satisfaction, and the clinic itself is really well run, and you know, a younger generation will definitely pay attention to technology, and they will see those as attributes that attract them. So those are really my reflections on that data, which I think is optimistic. I don't know, Dee, if you have any other thoughts on this. It's one of the more important findings.
Yes, definitely. And I think that if you think about practices maybe that wouldn't be new or emerging, some of the continuing practices, I think during the pandemic, many had to refocus and reassess, maybe decrease the complexity of their operation in some way. And I think that in a lot of cases that helped them begin to get back to what matters, what got them into this to begin with. And perhaps that's helping to drive some of the optimism as well.
I like that concept about decreased complexity and focus. I think there's some wisdom in that.
And I think we will probably learn a little bit more about that wisdom as we move on to the next insights. So I'm going to go ahead and move to insight number 2. The Cario data shows that independent practices in 2021 are more committed to delivering quality care compared to 2019. Dee, what does the data tell us about that?
Yes, Paige, and I think you're right that I think there is definitely a relationship between the optimism we saw in the previous insight and what we're seeing here in terms of the quality care. I think that those two went hand in hand in the survey. In the 2021 results, we saw that more than 70% of providers named delivering quality care as a number one practice initiative, and this was up from 50% in 2019. 55% of providers said that streamlining their care delivery workflow to allow them to spend less time in their EHR was most important, up from 43%. And we also saw evidence that they wanted to reallocate this time to care. Improved point of care documentation at 51%, up 13 points. Reduced diagnosis and diagnostic error, 46, up 6 points. And prescription management at 46%, up 5 points. And so there were quite a few findings in the study, the ones here as well as others that are in the report, related to the delivery of quality care. Gurpreet, do you want to comment on the quality of care findings?
Yeah, I think the important point was that, there's an increased affinity for quality of care because, of course, doctors have always cared about it. You can go back to studies from the 70s, 80s, 90s, and JAMA in 2001 had one. They all say the same thing, that doctors want quality of care for their patients. They also want efficiency of operations, and they want some level of input and autonomy in their work. And those three things come up, every decade, and quality is number one. It's the first thing they mention. Paige, I might wonder if you could advance to the next slide, because it allows me to show what I think is more of sort of the modern consideration, that we just can't say quality in an abstract way, and I liked how the data broke it down. But high-value care is another way to say high-quality care, which is that there's a numerator and a denominator, and we want to improve things in the numerator, like outcomes and safety and experience, and we want to decrease cost and waste. And I think one of the realities is, in the past, we talked about cost and waste in this sort of global sense, like the GDP or health system budgets. But increasingly, for our patients, we owe it to them to cut cost and waste because of the high deductible plans they have now. A lot of that money comes directly out of their pocket. And so I think this commitment is a positive finding, and I think it does reflect our changing focus. And I like how it's getting specific. There's specific ways we turn up or sometimes turn down quality. Does that sort of resonate with you, Dee, and sort of what you think, how people are redefining quality in an industry or in this industry?
I think it does, and I also think that one of the things that I like best about this finding is really to witness that shift of emphasis and that intention to reallocate time back to the patient. And when I think about this, I almost think about where do you find joy, connecting it back to the optimism piece. And so thinking about the definition of quality care, but also seeing the emphasis that the independent practices want to place on this as they go forward from 2021.
I really agree that liberation of time back on relationship makes a ton of sense. And I think, I think about what are the strengths of an independent practice is in the past, we used to think about quality as sort of something that could be scaled and, big systems could accomplish. But I think what we're learning is it has to be done through personalization and knowing the patient individually. And that's where I think the strength of a small practice and sustained relationships that you were citing makes us achieve these elements of that equation.
Right, I agree.
So I have a question for both of you. As we're talking about quality care, what has changed in quality care over the past couple years? What, in your opinion, what separates an experienced healthcare provider from an expert one?
I'm happy to take that because it's an area of interest of mine. Sort of, all of us can become experienced in something. It doesn't have to just be our job. I'm a experienced driver because I've been doing it for 35 years. I'm an experienced parent because I've been doing it for 17 years. But in neither one of those situations would I say I'm an expert, right? Because in each one of those things, I just go and try to do the same thing every day. I drive a car, raise 2 boys, but I'm not really trying to be my very best, if I was honest. But there are some things at work that are so important to me that I'm not satisfied with just like, I'm okay at this and I'm fine. I want to be on cruise control. I want to continually get better at it. And so people who are satisfied where they're at and will let experience be their only teacher will wind up being experienced practitioners in any domain. It can be listening to a heart, talking to a patient, doing a procedure. And then some people want to become experts, and it's not a competitive term with other people, it's just a competitive term with themselves. And they say, what extra effort do I have to do to get better at that thing? And I'll share, for me, the thing I've been really trying to get better at is communication skills with patients. Just because I've been communicating for all 48 years of my life doesn't make me an expert communicator. I've really had to go out and learn from some of my colleagues and experts what relationship-centered communication is. So that's an example of where I'm trying to go from being experienced at communication to being expert at it.
So true. Well, I mean, that kind of sounds like life advice across the board, right? We can all get better with communication.
Or the parenting or driving, they'll say all those things I mentioned for that same example. Yeah, precisely.
If my mom's listening, she's probably shaking her head right now. Well, and with that, let's move on to insight number 3. So the Cario data shows that independent practices in 2021 are offering telehealth services beyond the pandemic, and I'm really excited to jump into this topic. So, Dee, take it away.
Okay, thanks, Paige. So, as everyone knows, there was a rapid adoption of telehealth services during the pandemic, and this, in many ways, turned out to be the silver bullet for independent practices, allowing them to be able to reach and serve their clients and patients. And so, with Health and Human Services relaxing privacy regulations and the need for social distancing, this became the delivery option of choice for most providers and patients alike. And then emerging from the pandemic, practices are continuing to see telehealth as a part of their practice. And 43% of practices in the survey indicated telehealth was a critical initiative, and that was doubling from 21% in 2019. And nearly 90% of practices that were included in the 2021 study are offering telehealth to their patients. And so, Gurpreet, as you know, telehealth is one of the most discussed healthcare topics. So I'd love to hear your thoughts about delivering care this way and how you think providers now feel about this technology.
Yeah, Dee, I agree. This has got to be probably the most transformative thing that happened. I think before the pandemic, it was, I wouldn't say it's a fringe thing, but a small percentage of people were advocating for it and trying to get better at it. And I was in a system that was doing that, but I wasn't one of those providers. And then overnight, it became a universal skill, or I should say universal requirement. To turn it into a skill, hearkening back to our concept of experience versus expertise, it took a lot of practice. And I'm not talking about the tech side, sort of, logging on and making connections. We worked through all of that. It really took sort of a transformation in how you interact with patients. Like what we used to call bedside manner, now I had to develop my website manner. Like how do you forge a connection with a patient through the computer? And even exam things, things I've been taught 25 years ago how to examine something in medical school. Now I had to figure out how do I examine a painful abdomen or a swollen knee through the computer. And although it was rough going at first, I'm really thrilled that I upskilled in all those areas. And I will say one other thing, that's a very patient-centered benefit that we had. We were able to help our patients in that way, and I'm so overjoyed because sometimes I saved people long rides, expensive parking, long waits in our waiting rooms for things that were easily covered in short visits. We also had a connection with colleagues. I must say there was a level of coordination care that was actually very hard to do pre-pandemic, and now we could get 2 or 3 providers on a Zoom call and advance care for a patient in a way that we weren't either comfortable doing or didn't find important before then. So I think it's been a tremendous advance. It hasn't been perfect, but it's been a big advance in our skill set.
And Gurpreet, I would imagine
what your reflections are.
Yeah, so I would imagine that you interacted with a variety of patients, some of which were very comfortable with telehealth and wondering why it wasn't the norm way before this, and others that maybe were just a little hesitant or unsure. And I wonder what variations you saw in patients and what maybe you learned from that process.
Yeah, I think you're absolutely right, Dee. Like the number of experiences I recorded was tremendous. And I think I can share, first of all, you're right. There was a number of patients who were like, why weren't you doing this before? I have an iPhone, I have a laptop. Why did it take the pandemic for you to do this? And there was a little bit of chagrin factor because, again, I realized how much efficiency we brought them and ourselves by doing that. There is the flip side I think you were alluding to, which is I think we learned there's a digital divide. And the digital divide is either people who don't have access to all this technology for all sorts of reasons, but either they don't have the rapid internet or the hardware or the technical know-how, and that is one bucket that says it doesn't work for everyone. And then in honesty, there are a series of things that you just cannot evaluate properly without being in person. And sometimes they're mundane like rash, and sometimes they're really heart-to-heart discussions that somehow the computer doesn't cut it. So I think what we learned is it is now a new tool, but it's not a panacea. And there's a digital divide that we have to navigate as well.
Mm-hmm. Right. Yeah, a lot more learning that needs to take place related to telehealth, but it appears from the findings in the survey that it is definitely here to stay.
Yeah, I think it is here to stay, and I think every doctor, there's some technology doctors some take a pass on, like, for instance, I won't learn point-of-care ultrasound, I don't need it. I don't think any of us will be able to take a pass on telehealth anymore. It's going to be as important as knowing how to use our stethoscope.
Right.
All right, and with that, let's move on to insight number 4. Let's see. So insight number 4, the Cario data shows independent practices in 2021 are concerned with security and compliance when delivering care. And Dee, can you tell us about the data you found that supports this?
Sure. So in the survey data, we saw that there was about 58% of providers who said that security and compliance was their top priority for delivery of care. And so this was something about just general delivery of care, but it was also especially related to more remote care through telehealth, and just trying to make sure that they were compliant and that they were able to protect the information that was being gathered and making sure that things were secure. And so, Gurpreet, I'm very curious about what your thoughts are on what's motivating this concern as a top priority and what you think that this means.
Yeah, when I reflected on this one, I thought, like, on one sense it's top of mind, and in another sense it's like the last thing I'm thinking of. So, and maybe I'll start with the last thing I'm thinking of. Remember we started at the beginning saying, like, what we really care about is quality. And so I was thrilled if I could reach my patient on Zoom or Google Voice or Doximity Dialer or VA's Connect, whatever technique I could connect with my patient. The expediency of it made me really capable and comfortable using it. But security would always be running through the back of my mind, like, which is the best, which is the safest. The flip side is I think it feels like insurance. Every time there's a news story about, a privacy violation or a ransomware attack, it reminds us that this has to be front and center, because if it's not attended to, sometimes it can interrupt that quality of care, perhaps for a long period of time for your patients. So I think in this case, I suspect doctors are really looking for someone to help them with this. And we want it still to be seamless for patients and us. And I know that's a challenge for independent practices, because independent practices don't have huge IT departments.
Right. Yeah, absolutely. And it feels kind of like the risk of the unknown in a new world. You're not quite sure what's lurking in that world.
Right.
And when it comes to, making sure that you're protected, I think it's also difficult in today's world just in general to know what's good enough. Have I done enough? Have I done everything that I should be doing to make sure that my practice and my patients are protected?
Right. You're trying to, I think that's a great, well stated, like, you're trying to protect both of those things. I want to protect my practice and I want to protect my patients. And I would love for that to be a background concern. So my foreground concern is, what's the health issue of my patient and their welfare? So this is a tough one to navigate. And I know there's going to be more and more lessons and best practices that come up around it. But I'm glad it came out to the survey, because it's real life.
Mm-hmm. Right.
Hey, Grapri, I have a question.
Yeah.
As more care is being delivered through technology, is security something that, you find through teaching that is a lesson you teach students? Or at what point, I guess, in their educational journey do students learn about security and compliance and technology?
Yeah, it's a great question. I think there's not much. I think there's an adjacent topic which we're teaching, which is protection of patient privacy. But honestly, I think in modern curricula, it's much more around sort of social media, and the general principle of patient's information should be private. I think cybersecurity is really not taught in any specific way. in medical training right now, but it may become more front and center.
Absolutely. I can imagine, especially with all of the different types of ways that people can hack into things and all of the, personal health information and the ways that that's protected, and like you mentioned, social media. So I would assume that something will come down the pipeline eventually.
Yeah, I think by teaching the lesson of privacy, whatever it is, through social media or managing electronic medical records, trainees and doctors get the message that privacy is important. And maybe that's the most the education system should do. But it'll still be the business side of medicine, whether it's a small practice or a huge system, that has to be responsible for security, because that is, there are specialists who do their very best to work around the clock to prevent those sort of breaches. So I think it's too much to ask a doctor and their close team to manage.
Absolutely. Totally agree. So with that, let's go ahead and jump into insight number 5. The Cario data shows independent practices in 2021 understand patients are consumers and have multiple options for healthcare services. Ooh, I am so excited for Dee to dive into the data on this one.
Okay, so actually, I think, are we on the integrated technology solution one?
Oh, oops, I jumped ahead. Sorry, yes. I got so excited about that.
I know you're so excited.
I just couldn't. I'm so excited. I just couldn't help myself. So let me rewind. The Cario data shows independent practices in 2021 want to have more integrated technology solutions. I'm still excited about this one, I promise.
Yes, excited about this
good
one
reason.
too. Yeah. So, Paige, with this one, it really goes back to that desire to focus on increasing the delivery of quality care and optimism and all those things that I really think are tied up with the reallocation of time to the patient. And so what that means is that you have to be able to shift your time, and you have to streamline practice operations so that you can do that, unless you're just going to double the amount of time you're going to work, which nobody wants to do. So we need to have a more integrated technology approach to the practice. And so this insight emerged from the data as the only challenge that grew over the past 2 years, was having this integrated technology solution. And 38% in 2021 said they wanted more integrated solutions, compared to 33% in 2019. And again, it was the only challenge that the practices saw as growing. And so, Gurpreet, I'd be interested in hearing your thoughts on integrated technology solutions and what it takes to be able to shift time.
Yeah, I think Dee, you hit it on the head. Like, we want this integration, not because we have an innate interest in tech, but because it gives us more time, right? If you think of doctors in integrated solutions, we're always asking, why isn't my EMR working as nice as my iPhone or my suite of Google apps, where, things seamlessly move from one to the other and integrate? And to be fair, patients are asking the same thing. If they're dealing with the tech side of our practice, they're saying, like, why can't you auto import all my information from somewhere else? Or why can't I do a one-click like on Amazon? And both parties are saying the same thing. They're just like, can you remove the friction from with this technology so that, I can either give or receive great care? And I reflect on it, and I know from studies, patients see our whole suite of technology as sort of one experience. So even if there's a front end and the back end and they don't talk to each other, to patients, that's sort of the overall experience. And when you give them the technology of the office, they don't accept an explanation. I think, like, oh, it's another piece of software from someone else. Like, they need to see it all as making it a great experience. But Dee, I know this is your area of expertise, sort of how consumers experience this and make these choices.
Yeah, and I think that's a great point, and to bring in the consumer label at that point, because I do think people, even patients, are experiencing their iPhone and how technology works for them and how it makes their life easier and things flow seamlessly. And then when they go to the doctor, they're like, okay, wait, why is this so clunky? Why does it feel like the 1980s? And so I think that's an opportunity, especially with things that do face the patient. I got a text yesterday from a friend who was very surprised that she went to the doctor on Friday. Her results were emailed to her or in the system on over the weekend, and then on Monday, just automatically the the prescriptions came with instructions of what to do. And, and so apparently she's someone who hasn't experienced this from her previous doctors. And so she was very thrilled by this whole experience. She's like, this is just like shopping at the place I normally shop. Like this is what my retailer does, and now my doctor does it too. And so she was thrilled by that.
Yeah, and I think whether I thought of myself as a doctor, I'd be so proud to be part of a clinic that could do that, and I'd be so happy as a patient who was a recipient of that, because it's just hard to be different than all these other areas of our life, like making a plane reservation or getting to a restaurant or shopping, and then they have another bucket of technology, which arguably is the most important, which is our own health,
right,
not working like that. So I know it is a big ask of independent practices and huge health systems both, but I think it's almost going to become non-negotiable, because to your friend's example, right? Like if she has to choose between those two practices, I would bet that level of service is going to be a deciding factor for her.
Yes, this was a new practice for her, and that one experience, she's like, I'm with them for life.
Yeah, right. Sometimes one, and of course, if the converse happens, right? We pick a vendor or something and we have a bad experience, and we never give them another chance, even if there's growing pains. So I think that's a great example of how loyalty was built.
Right.
And I would say one last thing.
Sorry, go ahead.
Oh, go for it. Go for it.
All I wanted to add was, like, even though that's the tech side, the hope, of course, is that tech reflects all the great quality that's also given in person, right? That the whole brand is concordant. Like, we are great in person and we are great on the tech delivery of your care.
Absolutely.
Go ahead, Paige.
Oh, I was just going to say, well, now that you said that, two things. I think that is, that's almost the job of the technology, the software provider, is how can you create this experience for practices and for their patients where they're not losing, patients don't feel like they're losing that human interaction, that human touch with their doctors, and vice versa, that providers don't feel like they're losing that connection with their patients. And the other thing I was going to say on that is this is maybe a little bit of a selfless plug for Cario, but I do think that there are a lot more software providers who are creating integrated technology solutions and are able to provide almost everything a practice could need within one platform, so that you're doing one onboarding session, one training session. You're not working with multiple providers, multiple IT departments and help desks, and obviously not just Cario, but across the board. I think that is becoming more of the norm, which is inspiring and helpful for practices, I hope. And on that note, we will now move to insight number 6. The Cario data shows independent practices in 2021 understand patients are consumers and have multiple options for healthcare services. All right, Dee, now can you give us the data on this point?
Yes, I'd be happy to. So I think that underlying these insights is the recognition that patients are people who consume healthcare services. And so as consumers, they're more empowered today in all fronts of their life to choose services that meet their tangible and intangible requirements. And they know they have this choice. And so increasingly, independent practices are recognizing that they're not only competing against other practices and hospital groups, but mega companies like Apple and Amazon for healthcare services, and really for attention and expectations that people have as they go into the marketplace to consume various things. And the key to being competitive is becoming a more consumer-centric practice. And this doesn't mean abdicating who you are and what your expertise is to the consumer and just letting them pick, but it does mean recognizing that patients are consumers and that you have to understand their needs and their requirements and how you can meet those in terms of experience. And so in 2021, our data shows that 61% of those surveyed believe patients are consumers and therefore the patient experience matters. And independent practices want technology that supports consumer centricity. So things like offering online scheduling, online patient intake, more payment options, and appointment reminders. So Gurpreet, do you have any thoughts that you might want to share in terms of what this means for the independent practices and maybe the physician mindset that it takes to provide a more consumer-centric experience?
Yeah, I think that's the right starting point, which is sort of a change in our mindset, right? Many of us were not trained to think in a transactional way or in a consumer way. But I like that sentence where it says, 61% of these surveyed believe patients are consumers, and therefore patient experience matters. And I might just remove the therefore. I think it is absolutely true now patients are consumers. There are so many options and ways to consume healthcare for people who have access to it, but also that patient experience matters has actually been a truism for a long period of time. And one of the shifts I think that was very important for me was when we first started learning about this, I thought, patient experience, we're just trying to get these scores up to do whatever it takes to, whoever wants to consume those higher scores from my practice or my team. But what became really evident, it took some years of study, was that when patient experience scores goes up, the things that matter to clinicians go in the right direction as well. Like when we improve patient experience, blood pressures go down, compliance with taking medications increases, hemoglobin A1C, which is a measurement of diabetes control, all improves. And so more and more studies kept coming out saying when patients have a good experience, their health care improves and their health outcomes improves. And then you get to the point you say, well, listen, this isn't, this is, what is it that I can do then? And overwhelmingly, it's being able to enhance our communication. Sometimes we thought, the experience is amenities, right? Like a beautiful waiting room or something else slick. But it's the number one issue by far and away is how did my doctor communicate with me? And so it gives doctors a really tangible way to improve that experience. And I'm sure that's, you must have some reflections on that from all your studies.
Yeah, I think you're right. I think that relationship matters, and that congruence between who I am and how I want to manage my health, and who this provider is sitting across from me. It's not about me walking in and handing over all of my searches for things, but it's about, like you said, the communication, the interaction, how we build that relationship, how we build that trust, and how through that experience I come to believe that you're not just dispensing, but you are there to help me manage my care, my health through life, to accomplish the things that I want to accomplish in life. And that's why people enter the marketplace, right? The healthcare marketplace or the other marketplace, because they believe that there's something there that will help them to be better at achieving the goals that they have for themselves.
Yeah, and I think you said or alluded to it that the doctor is in the service of the patient, which we kind of understand at an intrinsic level, but we sometimes can lose sight of in the day-to-day hustle. And this reminds you, like, you are in the service of them, and they're coming to you for your expertise. And I think as I focus more and more on that, knowing that it also improves their health is just such a strong motivator. There is also data at the hospital level that patients with better experience also lead to more financially healthy health systems. I don't know if there's a parallel data for independent practice, but I suspect it would be the case. But the bottom line is really like, it's not just being nice. Like, it's not good manners. This is good medicine when we improve patients' experience.
Right. Right, absolutely. So that does become that partnership, that trust, that, being able to interact positively so that you have a better experience as a provider, but also a better experience, and like you said, better outcomes for the patient.
Yeah, I think that's a strong motivator.
And I think that's a great segue into our next key insight. So insight number 7, the Cario data shows independent practices in 2021 want to be a true partner in developing treatment plans for better patient adherence and outcomes. Dee, what can you tell us about this data?
So here I think the insight reflects the provider's recognition that patient adherence is a critical factor in health outcomes. And I think that patient adherence, like Gurpreet was saying, ties back to the patient experience and the relationship. So post-pandemic, independent practices say it's even more important that they are making a difference in their patients' health outcomes. About 60% believe that 70% or better of their patients will adhere to the treatment plans, and that breaks down to about 31.3%, who would say about 80 to 90% adhere to the plans, and about 25% who would say that 70 to 80% adhere to the plan. So certainly opportunity, even at 70%, to improve adherence. But it was very favorable to see that about 60% said 70% or more of their patients adhere. And then we talked to them about, in the survey, about what it was that they did to try to encourage adherence. And so 61% indicated that their top method is engaging in more dialogue to explore the patient's goals, understanding values, beliefs, and asking about their home and social environment and how it will impact plan adherence. And so really trying to think from the patient's perspective, and that empathy and active listening that allows them to be able to see the information that they're sharing and the treatment plan that's forming from the perspective of the patient. And then 54% said that providing relevant information to help with the treatment plan is helpful to being a better partner with their patient, which was a goal that they expressed. And so, Gurpreet, I wonder your thoughts about, with your background in diagnostics and physician behavior, what have you seen that supports this data? Is there anything that you connect with the information that was found in this survey?
Oh, I feel like each one of those points we could almost unpack, because there's really a lot of gold in each of them. I thought the one that really resonated with me was the notion of engaging in more of a dialogue, because it's sort of the foundation of shared decision making, which I know you have expertise in. But I have to tell you, for doctors, it's a journey. Even if we espouse it externally, internally, it's been work. I remember years ago I was talking about shared decision making, and early in the conversation, someone's like, "What do you mean? Like, I do shared decision making." And I said, "What do you?" He's like, "Well, I make a decision and I share it with the patient." And I said, "No, that's not how shared decision making works. You really have to pay attention. It's a whole different concept. You have to pay attention to what the person values, what's their concerns, and it is that dialoguing." Which, again, I'm as guilty as anyone else of saying, no, I'm good at conversation. I'm always in dialogue with my patients. But I think what's oftentimes the case is that I'm kind of controlling the conversation and ceding it to the patient and letting them share like their concerns and their values oftentimes has made me make much better decisions. So I've dialed down the medical info I download on them and uploaded the time that they have to tell me about, this choice of getting a CAT scan or the decision to pursue a referral or not, how that will impact them.
Mm-hmm.
And Dee, I love your reflections on this, because I know this is an academic focus for you, shared decision making.
Yeah, absolutely. And really thinking about the fact that you're right, it's not about presenting two options based on the evidence, saying which one do you pick, but it's about creating a space where the patient can share the information they want to share, and not just sharing sort of the treatment decision, but also sharing responsibility for what will be decided and how we'll go about deciding, as well as what the end goal of the treatment plan. And I think that shared decision-making happens when there's joint learning, right? When the provider and the patient feel like they've learned something from the interaction in some way. And they kind of have a commensurate investment to where the provider and the patient both invest information from their perspective and their life or their expertise, but they also spend equal time listening and taking in the information from the other, so that they leave the encounter with a joint attachment to or vested interest in the outcome of what was decided. And I think that helps there in terms of building adherence, building trust, building that relationship, and everything we were talking about in the previous insight as well. So I don't know, Grapri, if you have any thoughts on that.
I picked up on that term of joint learning and then joint investment, and I just want to reflect on those. That's exactly it. That sort of this idea that both of us are coming with expertise. Like, I, as a doctor, am coming with the medical expertise, and the patient is coming with their life experience, value, expertise, and there's no question about those. But the amount of listening that happens, and you can learn from each other. And then when we do sort of meld those two together, we are jointly invested. I love that. It reminded me, I had a patient with a trainee a few years ago who his diabetes wasn't well controlled on 3 medications. That A1C measurement I mentioned before was going in the wrong direction. And we said, "Sir, it's time for you to start insulin," which at that time was going to involve refrigeration and carrying syringes. And he said, "Listen, doc," he's like, I know I'm supposed to do that, but there's just no way. I run a business. I'm out in the field. I can't carry refrigerated insulin and needles and things like that. And then, can we do another way? And we were really we walked into the meeting, me and the trainee, dead set on selling him on insulin because we thought it was the right biomedical thing to do. But in talking to him, we realized that we had some room to move on medication that he didn't want to take more of. He made a commitment to make a specific dietary plan. And we sort of described it like, instead of wrestling with the patient, we were dancing. We were going back and forth, and we both walked out of the room saying we kind of each he got a little more medicine than he wanted, but didn't have to take insulin, and we didn't get the perfect diabetes plan, but we got one that we really believed he was going to follow. And that was one of my, I think, seminal moments in the trainee I was with, where like that's what shared decision making is.
Mm-hmm. Great example.
I was going to say that's a powerful example. I think really puts into perspective what that means from a provider standpoint. And with that, I want to make sure we have time for the last insight. So key insight number 8, the Cario data shows independent practices in 2021 want to be more engaged with patients to offer a more satisfying patient experience. Dee, what can you say, or what does the data say about that?
Sure. So I think that this 8th insight in many ways brings us back to where we started. So it highlights here some specific objectives that independent practice providers have for their patient experience that then relates, I think, to the quality of care and optimism where we started. You know, they want to offer more personalized and collaborative care, increased two-way communication. So this was 58% in 2021 compared to 39% in 2019. Flexibility in scheduling appointments at 57% compared to 41% in 2019, and finding more ways to lower patient no-shows, improving patient intake, and patient appointment reminders. So those are some of the things that they're seeking to do in the patient experience that they feel will create a more satisfying patient experiences. And I think that independent practices in 2021 know that they're in a unique position now where they really have that flexibility to set the pace for where healthcare is going in the future and what patients can expect with that. And this recognition that it happens with every single interaction and making sure that those interactions all have a better patient experience at the heart of them. And so, Gurpreet, I'd love to hear what you think about these findings and how they relate to what you've seen with your background, your experiences.
Yeah, I think in some ways this is a summation of many of the points that we've made, right? So that the experience matters, that it relates to outcomes, that it's satisfying for both parties, that it's every touch point with the healthcare system. I think one thing as a doctor is oftentimes at least if I wasn't running my own business, I'm just worried about what happens with me in the exam room. But just remembering that every touch point with my clinic or my business is the same to the patient. They feel that the doctor or their team is responsible for it. And so just imagining how someone experiences it, I think it's almost this form of servant leadership where I say, I want to know what the experience is like for you. I might, be a secret shopper myself. I might query them about parking, even though I'm talking to them about, what's going on with their blood pressure. I might ask if they're running into some technical problem rather than saying, well, yeah, someone else will help you. I might say, it's not my strength, but I can find the person who can help you with that because it signals to them that I want everything in our business and our clinic to be a great experience for you, not just the time we have in the room together.
Mm-hmm. Right. Right, definitely. Yeah, thinking about that patient journey, I would think, the sort of patient journey from the time, the time that they begin to think that they're going to come and see you all the way through until after they leave and then go home to execute whatever the treatment plan is.
Right. And I don't want to overburden doctors. Like the excellence I do want to achieve is still what I'm supposed to do in the exam room. I hope I've made the pitch during this that at least in my growth, I started my career very early on focusing on how doctors can become smart, literally like uploading all the biomedical knowledge to make us a great diagnostician. I've just come to learn that that only gets me so far, and to really get better and better outcomes, it's actually not how smart I am, how many diagnoses I can bring to mind, how many right treatments I can pull out of my repertoire, but really how I can engage through communication. It's a procedure that we probably do about 200,000 times during our career by some estimate, if you can imagine that. If I did any other procedure in medicine, how could I not be improving that? So I want to make sure that doctors understand that is still the in-room focus is where we should be pushing most of our personal expertise, but having some sense of how the patient experiences it is I think the broadening of perspective that could help all of us.
Mm-hmm. I think that's a terrific point.
Follow-up question on that. Oh, sorry. Go ahead. Go ahead, Dee.
I just said, Paige, that was a terrific point, I thought.
It is, and it brings to mind, I mean, you're working with so many young and upcoming doctors and physicians, providers, nurse practitioners. Do you feel like, because I think it's safe to say that younger generations are more quick to adopt technology, and with telehealth and remote care delivery becoming so prominent during the pandemic, do you find it harder to engage with patients through remote care delivery options and telehealth, or do you find that it's actually easier because it's on their terms? The patient, it's kind of like a pick your own journey.
Yeah, or choose your own adventure, as it were, for the provider.
Yes,
no, I
yes.
think that it won't be harder or easier. I think it'll be that we're learning when it's the right person and the right condition and the right time. I mean, I can't tell you how I haven't done home visits in my career, and the number of homes I've seen in this past year is remarkable. Like I'm doing home visits and seeing people's spouses and dogs and setting and why it's hard to walk in this way and what barriers exist for them to have a good night's sleep. I mean, all these things that telehealth has shown us. So I think it's going to be more judgment about, I have a great relationship with you now. This will be very easy for us to do this through telehealth. Or conversely, I know you so well. I know this one isn't, and your condition, this isn't going to work through telehealth. I really need to see you in person. So that's sort of getting back to how in independent practice, you know your patients so well, you can easily size the solution for what's going to be best for them. And I hope I can use it that skillfully as I keep getting better and better at it.
And Gurpreet, that brings to mind an example for me that a friend of mine did research for a maker of bathtubs. And, so she actually spent thousands of hours a year in people's homes watching them take baths in a bathing suit. And you think about, when you were talking about seeing these people's homes and seeing the challenges that they have, sometimes manufacturers of products like that know more about the people that they're serving than perhaps a provider does. Not that they can spend thousands of hours in there, but I think, how can, in the interaction that you have and the conversations that you have, how can you at least have that desire to learn, even to look around while you're on telehealth, to bring in more of that information?
I love that insight from the bathtub maker because, there's nothing like seeing people there. We see them for 15 to 30 minutes, right? And then the other 23 and a half hours of the day are spent in the real world. And so getting a glimpse of how they live and thrive or struggle in the real world is priceless.
And with that, we're going to go ahead and collect final questions. I want to thank you, Dee and Gurpreet. That was an absolutely phenomenal presentation. I hope everyone else feels the same. We really got to dive into the key data insights from the survey and the report. Before we get to everyone's questions, I want to take a moment to let you know a little bit more about Cario. While I'm doing that, like I said, please feel free to enter any final questions, and our panel will get to them in just a minute. Cario is the leading cloud-based technology platform that's specifically built for the success of independent medical practices and the billing companies that serve them. And we've been honored with numerous awards and acknowledgments for value and functionality for EHR, billing, and practice marketing solutions. Cario's complete and integrated solution includes Cario Engage for practice marketing and patient engagement, Cario Clinical, an easy-to-use and intuitive EHR, and the powerful Cario billing module, an integrated practice management system to help you get paid. Cario offers valuable added services such as telehealth video visits, a robust analytics tool, and effective and affordable patient payments and patient statement solutions. And now the questions are flying in, so we will get to as many as we have time for, and then we will work together to get the rest of these answered and send them out to everyone. Gurpreet, this one looks like it's for you. Are telehealth only practices a common thing, especially nowadays? And do you find that your students lean more towards a practice that only offers telehealth or remote care delivery?
I will say that even before the pandemic, there were a lot of startups that were telehealth only. I do not know yet about trends of independent practices sort of building that are telehealth only. So there are apps and websites that did that previously. I will say a lot of them were not relationship-based, right? They were just focused on single interactions or single problems. But yes, a lot of our trainees that we're hiring on now, they want some component of telehealth in their job. We don't have a lot who want 100%, but they like a component of it.
Interesting. And that kind of brings us to our next question. So we've received a ton of questions about telehealth reimbursement and that relationship with insurance carriers. Do you see telehealth remaining a reimbursable option? Like I said, there's been a lot of rumors about insurances returning to limit telehealth payments. I'm just curious what your thoughts are on that or what you're seeing.
Yeah, I don't have expertise in the reimbursement because it's a moving target. I read this past week there was an editorial in the Wall Street Journal about someone lamenting sort of a patient who's in New York who has to, if you can believe this, to see their doctor in Boston, which they could do through telehealth now through some arcane rule, has to drive across the state border and park her car inside Massachusetts to do a telehealth appointment with her doctor in Boston. So there is this concern about some of those flexibilities being pulled back. And I hope that those are blips and that either clinicians or patients or all others do push back against it. But I do share that concern because we never know what were temporary provisions during COVID, if they'll last or not.
Interesting. So that, I feel like we just
it would be illogical, but it would be possible. Yeah, that's the answer.
I think what we've learned through the past, 18 months is anything is possible. So
yeah, well said.
It looks like we have time for one more question. And this, I think, this is for both of you. So how can solo practices afford IT integration? And how can they implement it successfully? Most solo practices cannot afford it. Is it more efficient for it is more efficient for larger practices? Are there any suggestions on incorporating technology into practices and partnering with an IT solution or taking that on as an independent practice?
Yeah, I don't know if you want to comment on that and
sure.
The doctor's perspective.
Well, I guess my first thought comes in that you have to make sure that you're managing your practice instead of your practice kind of managing you. And I think one of the things that we heard in this year's report is that that focus on the quality of care and the reason you got into this business to begin with is the most important thing. And that's where you'll continue to find joy and optimism in your outlook on your practice. And so it's not like you need to run out tomorrow and get an integrated technology solution and all of that. But you do need to be looking at your practice and saying, what's the balance of time that I have? And am I doing things that I don't have to be doing, that technology could be doing for me? And yes, it might be a cost right now, but over time, it's going to allow me to focus on the patient experience, the quality of care delivery, and those sorts of things. So I think that's something where you just have to be, you have to allocate time to think about how things are going. I don't know, Gurpreet, if you have other thoughts.
No, first of all, I love that quote. I'm just going to say it again. I wrote it down. It said, you have to manage your practice. You can't have your practice manage you. I am empathetic to the question that was raised, which is, it is so expensive to have IT, whether it's in-house or out-of-house. And yet at the same time, I think it's going to become sort of an investment, the way that, practices paid for EMRs or practices contracted out for other services. And the hope is that it's an investment rather than just something that sits in the debit column of the balance sheet. That in doing that, you have more time and more bandwidth to take care of patients and generate more revenue and have more meaningful outcomes from them and better measures. So I would say it's expensive, and my hope is that it's an investment so that you never have to worry about it and it fades into the background.
Well, and I think, I spend a lot of time talking to independent practices, small practices, about their technology solution and what platforms they use. And, I've found that there is a little bit of a myth about, I definitely don't want to say that technology isn't expensive. I think comparable to doing a lot of things on your own. But then, I hope that people stay open-minded to, yes, you may not be paying a lot of money for an all-inclusive technology platform or an IT consultant to help you manage that. But then how much time are you spending after hours going through paperwork or trying to organize or submit claims? And so, kind of to your point, it's an investment for a more streamlined workflow. And when all of those things happen simultaneously, and that claims are getting submitted correctly and that patient collections are being collected at the time of service, then that starts to make up for that initial investment. And I feel like that's a conversation that I have a lot, and I know that I will keep having, but it's definitely worth the investment, your time and energy. And with that, I just want to say thank you again, Dee and Gurpreet. That's all we have time for today, and thank you to all of our attendees. Like I said, we have collected all of your questions. We will work together to get those answered and sent out after the webinar. But in the meantime, we encourage you to go to Cario.com for more educational tools and content. And we look forward to connecting with you again at the next webinar. And stay tuned for the 2021 State of the Independent Practice Industry Report. It is being released very shortly. Thank you so much, everyone. Have a great day.
Thank you so much for the invitation.
Yes, thank you.